So, unfortunately, a lot of women don't like to talk about it, but sexual dysfunction is quite prevalent. It may just be mild. It may be that sex doesn't feel as good. You only have sex because your partner wants to. Your sensation's limited. You're not able to climax, or you have no sex drive. Well, in our practice, we really like to explore that further. It's a huge part of women's health, actually. We're not here to just do a treatment and say goodbye. So we like to make sure that your anatomy is normal, your sensation is truly normal. Sometimes a woman may have normal sensation, but the tissue has laxity in it. From aging, rapid weight loss, childbearing, any of these things can cause some laxity in the tissue, and that will decrease contact if you think about it. And that's going to decrease your sensation. And it can even decrease sensation for your partner too. So it's not even just about you at that point. One of the things we like to talk to women about that they often don't think of is that there's a whole old terminology, use it or lose it, that applies to sexual health. As much as I think we both ought to be engaged in having sex, if you are not going to engage in some form of intimacy, that can be detrimental to you. I'm not saying I'm still fully endorse safe sex and abstinence until you're in the right relationship, but frequent sex 2 to 3 times a week or some form of intimacy helps improve the blood supply to that area, helps with the elasticity. And then if you are having problems, it can help reduce some of your pain. And that's one of the techniques we have to talk to patients about on a regular basis, and helping them overcome any difficulties they have. So one of the things we like to offer for that is Votiva, the radiofrequency ablation, that's going to help tighten that tissue. Those results we're seeing with the first treatment. Again, we don't recommend just one treatment, but we are seeing positive results with a single treatment, a single 10-minute treatment in the vagina, and those patients are able to enjoy sex that much better. The other things we offer are O-Shot, which is a platelet-rich plasma, which is your own blood that we draw, and then we spin it down to get the platelets that are concentrated in the plasma. We add calcium to it to make it thicker. Then after a very detailed anesthesia approach, we do it here in the office, but we do make sure that you're fully numb. Then we inject that mixture into the anterior vaginal wall, over the bladder, and then around the clitoral region. I know it sounds painful, but I can assure you, we make sure that you're comfortable throughout the procedure. It's a short procedure, and then oftentimes you can experience improvements in continence, but more than anything, improvements in sensation again. Another thing that we like to offer in our practice is pelvic floor therapy. So some women, sex is just painful. It can be painful because they tighten their pelvic floor. Maybe they don't realize that they're doing it. Well, we can actually work with teaching them to relax that pelvic floor by using biofeedback, showing them how they're contracting their muscles, teaching them how to relax them, educate them. Even using vaginal suppositories that have medication that helps them relax their pelvis. We also use Mona Lisa. For some women, years of dryness and not being able to find a medication or use a medication that helps, the tissue has tightened up over time or is very thin and breaks. So we're able to use Mona Lisa and help treat that, especially as they may not be a candidate for medication or medications have failed them. Sometimes they just need a gynecologist to look and see. They may have a skin condition that's gone underdiagnosed. We see that every week. Somebody's been seeing a provider for years that didn't know that they had lichen sclerosis, another skin condition that was causing their pain, or they were too embarrassed to share their problem. But we really pride ourselves on trying to figure out what is going on and giving them an easy ear to talk to.